Can you share us with one good example of this treatment and one of your patients, maybe somebody recovered completely by this treatment?
Oh, there are thousands. We've treated, I think, so far.
No, for example, like Malia, because the other day at the Beautiful People Gala, she was mentioning to our viewer that she recovered completely. Thank you to the Clinica Hilu and Dr. Lehman Hilu that she was very, very appreciated by.
Well, Maria, you mean Maria Pineda, the catwalk model? Yes. In her case is very exceptional because her disease is very, very serious. She wasn't in good shape when she came to see us, but she is a very, very good patient. And this is something that we should never forget. If the patient goes to the doctor only to listen, but they don't do what the doctor says, it's useless. And Maria is one of those good fighters. So whatever I told her to do, she was prepared to do it. She doesn't live here. She lives 200 kilometers away from here. And every time I tell her, come, you have to do this, she comes and she stays for 1 week, 2 weeks, whatever is needed, stops everything, and she does any treatment that I tell her. And thanks to this, she's functioning pretty well. She's still under treatment. It's a long-term treatment in her case because it's a complicated condition, but she's doing pretty well. She's back to work. She feels happy. She feels energetic. She's back to nightlife. She's always out, and this is...
I was quite surprised when I saw her at your gala, the Beautiful People magazine. I was like, wow, she was so beautiful and looked so healthy and energetic. Yes.
Yes, that's why it's the secret. In fact, is maybe 50% the doctor and the hyperthermia and the good devices that we may have at the center, and the other 50% is a good patient. A bad patient will make the work useless. In fact, and Maria is a good patient.
Determination and braveness, I think.
Yes, that's very true.
And other, for example, I heard many deportistas, sportsmen, coming to this clinic to have a treatment.
Yes, in fact, some of our sports people started off with us before winning any medals, and some of them now are Olympic winners. Some are obtaining very, very good marks in their sports work, especially in swimming. We have very good results with swimmers because we can help them use the oxygen in the body to the best degree possible, and this is very, very important for swimmers. Also golfers and tennis players, because they keep suffering from tennis elbow, from golf elbow, and we can help them a lot with our treatments. In acute cases, we can even employ one of the techniques that we, although it's surgical, but it's minimally invasive, which is the usage of stem cells to correct anything that may have gone wrong in the elbow, in the knee, or wherever in the body. And we do it in less than 25 minutes. And then the sportsman or sportswoman, the patient would go home immediately after. And we don't even have to use stitches. So we have very, very nice techniques for sports people.
Wow, that's impressive. So it's like not only for the Olympic Games and the sportsman, maybe for a dancer, a classical ballet dancer, or any other, or riding the los jinetes, you know, the horse riders. Because I had so many horse accidents when I was doing show jumping when I was very, very young. I still had some part of the body because for us, I'm an amateur. So for the professional horse rider and show jumper especially, they constantly fell off the horse almost every day, even the Olympic rider. So they need to be taken care of properly, their body.
That's true. And by the way, you are still very young. So this is not, okay. Horse riding is one of the sports that makes the body or demands from the body a lot of muscular work. Practically all the muscles in the body are put into action when you ride a horse professionally. If you are riding a donkey, it's very different. But if you are doing that professionally, you really have to be in good shape. So in this case, it's very important to do a preventive medical study and adjust whatever treatment is needed to make the person be in best shape possible. So there are no set rules in this case. There's not a specific protocol for horse riders, but yes, we have to do a full checkup and see and find out, discover where the weak points are.
That's good.
And reinforce them. This way we can even prevent sports injuries. Not only wait until they get an injury, even we can go ahead of time and try to prevent such accidents.
That's very good. Well, that's good to know for all, especially because I have so many friends playing polo and show jumping. My master of the horse, he's been a captain of the Spanish Olympic team, and his wife has been Atlanta and Seoul Olympic rider. And I'm an amateur. I'm not that good, but I have so many friends in the horse world, and I'm always worried because constantly there have been an accident, they have injured. But of course, we have a passion for the horses, and we love natures, and especially Andalusia, the horse culture. It is a culture, for the big culture for the Andalusia. We like to keep, So I like to know more, to visit the clinic and. They ask the advice from the doctor. Maybe the things that you are thinking that it will never cure, maybe here a doctor will cure you with this treatment.
In fact, talking about horses, the patient that I've just been treating before coming to this interview, he's a good friend by now because I've been treating him for many years. He owns 900 horses. He has a beautiful collection of horses, so I have to introduce you to him one day, and maybe you can give him an interview. He's quite a character. And you mentioned also something about the dancers. One of the doctors that form part of our team here, he is, and his wife as well, but he is a foot surgeon, and he is a European champion of I think, ballroom dancing. Himself, he is a champion, so he dances very well. And that's why he has a very good domain of the foot. And he does fantastic jobs with ballet dancers and with salsa dancers and with sport dancers. Also minimally invasive, although it's surgical in most cases, the work that he has to do. But he does it in such a way that it's minimally invasive and that recovery of the patients is quite quick.
Oh, that's very good things to know that the doctor himself, the foot doctor himself, is a great dancer. I mean, ball dancing, it's a very hard sport, and classical ballet also, because your body and how many hours they have to practice a day, maybe 4 to 8 hours.
Yeah, and when it comes to ballet, the ballet dancers, in fact, they need psychological support in order to. Probably most people don't know that, but ballet dancer, they suffer a lot of pain when they go on the tip of their toes, that it's under normal conditions, a normal person will not be able to support this pain. And they support it for hours and hours and hours, and they even smile while they are in pain. So a good support, a natural good support, we don't want to drug them, is good for them, and we also personalize treatments for such type of patients. So the thing, I mean, the main thing that we do here is that whichever sport you do, whatever profession you have, whether you are ill or you want to do preventive medicine, it doesn't really matter. We always do everything tailor-made. We fit our treatments, our suggestions, our advice, our diets to suit the patient's or the client's, if it's not a patient, necessities.
That's very nice, because it's very nice to hear also, because everybody who come to clinic, not only this clinic, when we go to the hospital or clinic, we get a little bit nervous. This is only normal, because if you have not a medical doctor's title, you don't know anything about your illness, so you get scared and you get nervous, no? But I think psychological support, as you just said, is very, very important for the patient, because that is almost like half of the treatment, because the patient, they need to know, they have to understand what's going on in their body and how they're trying to fight over this, if it's a cancer or if it's a other of the physical injury, anything. That the main thing is how to fight over with the doctor's help, but psychological support will help a lot, I think.
Yeah, that's very true. I mean, what we treat is not a disease. We treat a human being, and a human being is not a piece of meat. It's not just a joint. A human being is not a liver. So you need to take everything into consideration, like you are very rightly mentioning. So we have to bear in mind how emotional is this person, what type of diet they follow, whether they do or not exercise, what illnesses in the family, what genetic record there is, pains, aches, everything. We have to take note of every single issue that's related to that person and treat the person.
And here also, I think many young women or old women, like my mother's age, also they're interested to know if there's some special treatment for the women.
Yeah, hopefully your mother is not listening to this. You've just called her old, but yes, there are. We have a department for anti-aging, in fact, wherein we measure the biological age of the patient and we compare it with the passport age. And if there is a big difference, they need help. In some cases, there isn't a difference and they want help and they still want to reduce their biological age, which still can be done. And it takes, this is not an easy work to do, because in this case, rather than being 50% doctor, 50% patient, in this case, it's 10% doctor and 90% patient. The doctor will just tell the patient, according to the readings we get from this anti-aging unit, we get different readings, things that can be improved, and most of the work will be carried out by the patient. So good patients are excellent patients for this type of treatments. And normally they are, because people who come for anti-aging treatments are not old people. There are people between 40 and 50 years of age. There are young people who want to look like
25
and feel like 18. And this is the best thing to do. Instead of waiting until you are 120 and wanting to feel like 80, which is not a big difference really.
Okay, so maybe my cousins, my friends, maybe, yes, my mother can come here. And yes, to get to know more about this treatment, because, okay, we have a passport number for the documents, for the national security and for our world, but we don't have to stay on our documents, the passport age. Yeah, we can remain as a 25 always.
In fact, in this case, I can help you not to lie when you say your age. For example, you are 30 years old in your passport, but if I give you a treatment and you become 22, and they ask you, how old are you? You can say 22. And you're not lying because you have a medical certificate indicating you are 22. So that's something good to know.
That's something very good to know, and I'm sure that all my girlfriends are in front of the camera now. So I think I'm going to do the small group of my friends and include my mother. We'll visit you very soon.
Okay, you'll be more than welcome.
Well, thank you very much, doctor. And next time when we come here, we like to see some equipment of those treatment. If you can share us, then if people see those, the machines, and they get less nervous when they actually come in here to get a treatment.
Yeah, that's very true. Yeah, we can organize that. No problem at all. There are no secrets.
Thank you very much, doctor.
It's a pleasure. It's a pleasure. Thank you for the interview.